Hello guys, welcome back to another video of nursing. So if you are a nurse, if you are planning to become a nurse, I wish somebody had told you these things, because if your nursing is just after money, if your nursing career is not coming from the heart, then you will not be able to pursue or to work as a nurse for the longest period of time. You will be somebody who each and every time want to quit the career, want to quit the job, or you will be somebody who is wishing and regretting that maybe somebody would have told me all these things, and maybe you will be regretting of becoming a nurse. But you are in the right place. If you are a nurse, just know you are blessed and you have a special place in heaven. So these are the 10 things I wish I knew before becoming a nurse. 10 things I wish somebody would have told me before becoming a nurse. So, number one, okay, let me say this before I start listing them and explaining them. We all know that nursing is not easy. Unfortunately, however, they don't tell you, or they don't tell all the reason why during your years in nursing. I don't know why they don't tell you all this thing about, they don't tell you the truth about nursing. Nursing is not easy. In case you're wondering about the harsh reality of becoming a nurse, here are things I wish somebody would have told me before becoming a nurse. So, number one, which is most hurtful, which is more. Number one, you will be in a position to see more death than you want. Every day you will be seeing deaths. You will be like, I don't know how to tell you, but although we can try as hard as we can to save all our patients, death is still inevitable. Death is still inevitable for some of them. Yeah, for some deaths, I can say they are still inevitable. And no matter how many deaths I can encounter in my shift or the entire length of my career, I don't think I'll ever be desensitized to it. In fact, it is still every time. In fact, it will still happen every time. So in this career, just be sure that you will be seeing every day of your life, you will be seeing death. Death from accident, death from chronic illness, death from acute illness, death from several diseases. In this career, you will just be seeing death each and every day. Number two, body aches are common. Nurses work long hours, walking around, turning the patient and standing for the entire shift, and also giving all medication while walking, doing a lot of things. Nursing is not for the weak. You have to learn proper body mechanism and basic stretching routine if you want to save yourself from these body aches. Nurses usually work long hours, and that one you know very well. And you have to learn so many movement mechanism working techniques, and stretching routine, so that you save yourself from all these body aches that might come when you are still a nurse. Number 3, just know that you are not just a nurse. You can be nurses are everything in the hospital. You can be a doctor, at the same time you can be a pharmacist, at the same time you can be a clinician, at the same time you can be a casual, at the same time you can be, how do you call those people? You can be a store, those people who manage the store for if you are in a health center, you know how well how you do it. You can manage the store, you can manage everything. Nurses are everything in the hospital. Without a nurse in the hospital, doctors usually go to break. They will say that, no, without a nurse in this ward, I'm not going to attend to these patients. So just know that you are blessed and you are doing the right career. Don't regret of becoming a nurse, even if you're still searching for a job, or if you are still tamaking for a job. Don't regretting of becoming a job, because you know right now sometimes getting a job can be tricky, as much as we say that it is a career that is at least compared to other careers. So nurses, if you are a nurse, you are not just a nurse. You are everything in the hospital. You are a storekeeper, you are a casual, you are a pharmacist, you are a clinician, you are a doctor, you are a therapist, you are a counselor, you are a manager, you are everything. You are everything in the hospital. So just so that you are in the right track. Number 4, there are a lot of things you have to remember. If you are a nurse, you just don't do nursing from school and you forget everything. There are a lot of things that you will have to remember, even if you're in the shift. Let me say, on top of memorizing the name of your patients and the room number, you also have to be aware of their medications, lab results, vital signs, in case a doctor comes in the ward, maybe for a review, and ask you, please kindly tell me more about this patient, because you know you are the person who is mostly staying with the patients all the time. So the doctor will inquire from you. You will not have to go to the file every time and confirm all these things, even if they are there to help everyone who want to confirm or who want to remember. Just know that you have to have all this information in your fingertips. So you have to remember a lot of things. So you must have a good memory. I think I have explained that one well. Number 5, you need to know how to have a good laugh. Nurses are not known for having the best sense of humor. Nurses are not known for having the best sense of humor. As a matter of fact, they can often look odd for having fun at almost any time. With everything you have to get through each shift, you need to have a good coping mechanism. It is not having a good laugh, a good way to distress. So most of the time, you know what nurses usually go through in the ward, in the shift, sometimes can bring them down. They are also human beings, and so most of the time they are always moody. They always think a lot. So nurses don't appear to be happy most of the time. Even if they can cover it, you can get good nurses who know how to manipulate all these things. They can cover the stress that they are going through in real life situation and attend to other duty, the career duty, in a peaceful way, but not all of them. So just know that nurses go through a lot. Number 6, you'll feel tired and underpaid and overwhelmed. Most of the time, those are the things you will go through. With so much work you do, it is easy to feel overwhelmed by the job. This emotion can even push you to the edge of quitting the job, or quitting your work. If you are planning to become a nurse, make sure it is coming from the heart. Make sure your nursing career is coming from the heart. But if you are only after the salary, nursing might not work for you. Get it right. If you're planning to become a nurse, know that it is from the heart. It is from the heart. But if you are after salary, nursing might not work for you. Number 7, we are almost there. Your nursing career doesn't end when you leave the hospital. If you are a nurse, even if you don't want, even most doctors, most nurses, most healthcare providers, they don't usually want to be recognized as nurses or as doctors, because they know the responsibility which will come after that. You will find that in your house you are doing nursing procedures. You will find that in your family, in your village, you are the doctor, you are the nurse. You consult everything. You advise everyone. You manage everybody, everything, everywhere. So you don't just leave your nursing career in the hospital if you leave for a shift. For most people, a nurse is someone who works with the patient inside the hospital. That is what they know, and that is how I know outside there you think. While that is true, you can also pursue nursing career in different environment. If you find it hard to adjust to hospital setting, it doesn't really mean you should leave the profession and take a new career. You can try working as a nurse in schools. You can try working as a nurse in community, and you can try working as a nurse in research facility. So your nursing career does not just focus on the hospital only, because some people are weak. It is adjustable. You can adjust yourself, or you can adjust your career so that you work in different environment if you are not ready for the hospital, because hospital is for people who came to nursing, who started nursing from the heart, not they came to nursing after the salary. The next thing, or the next point, it is all right not to know everything, but it is obvious that you should ask if you're not sure about anything. And that is why we say nurses usually learn every day, because there are some protocols that will change according to the world, WHO. There are some procedures that will change according to how maybe the conditions are changing. Some things have been adjusted because of the technology, because of social, because of economic, because of a lot of things. So you must adjust to environment. You must be ready to learn every day. So that is why we say nursing is a learning career. You continue learning each and every day. The next point, in nursing career you can get a blessing or you can get a curse. So just do your work well, you will get a blessing. But if you are after corruption, if you are after money, if you are after salary, if you are doing things, you are after doing things which are not correct, then just know you will get a curse. The next point, nurses usually doesn't have time for themselves. If they don't have time for their family, where will they get time for themselves? Most of the time you will see nurses are very busy. They don't go for holidays. There are no long leave that is scheduled for them. They are always very busy. They are always in hospital. So just know that nurses don't have time for themselves, but they can decide to create time for themselves. The next point, no holidays for you, no nothing. You are in the hospital from the day one you started. You are, apart from the day offs and maybe the leaves that the hospital has scheduled for you, you will not get free holidays. And sometimes even if you are on leave and there is an emergency, you can be called to come and assist. So it is not a guarantee. You can come to the hospital anytime. Nurses do not have time to waste in this life. So if you are planning to become a nurse, just know that you're not going to waste time for doing other nonsense. If you are a nurse and you feel that I've left something, or if you are planning to become a nurse, or if you are a friend to a nurse, or if your family is a nurse and you feel that I have left something that you wish you were told before you started your nursing as a career, you are free to comment in the comment section and tell me that I wish I knew they told me this before I became a nurse. So bye, let's meet in the next video, and don't forget to subscribe, don't forget to like, share and comment. Bye till next time.